All, this is Dr. Mubin Sayed, and you are in the KoolBeens Cafe. So somebody asked me if I'm working with FLCCC. So yes, and I'm really enjoying it. So we are partnering specifically on long COVID, and I think one of the reason is that I was just making too much noise to everyone that long COVID patients are going to become ignored. Doctors are not fully aware. Healthcare, there is awareness on the long COVID, but less on the vaccine related lingering effects. And so this is going to be a problem. And if we take, for example, UK's report that says 8% of the COVID cases become long COVID, these reports do not yet talk about any possibility of vaccine related outcomes. But this is a problem. And here I'm not saying that the vaccine causes long COVID. I'm just saying that the symptoms overlap. So these are the kind of problems that are going to be an issue. So I was making a lot of noise that, hey, we should get ahead of it. And so FLCCC said, so why don't you lead that part? And so that is how we started working together. So I am very specifically working on the new protocols for vaccine related matters and protocols for long COVID. That is the discussion. I'm pretty proud of it. Dr. Merrick calls me nowadays very often. We talk about various pathologies. We talk about the mechanisms. I'm so so happy that sometimes mechanisms are just there. I can just very quickly start talking about the mechanisms, and so it becomes a very interesting discussion where he says, I read this paper, and I say, okay, I know that this is the mechanism in there. So we do some chit chat like that. And the result of all of this, he's studying, he said that he read 10 papers yesterday and today was discussing them with me. So all this hard work eventually would result into some protocol that hopefully will help uh, us all. So that is the background there. Very happy to be with Dr. Pierre Corey, with Dr. Paul Maddock, with Dr. Keith, and the remaining team there. Area is very specific, lingering side effects plus education around that. And then today, what I wanted to do was, thank you very much, Cynthia. So I'm glad that I had led the I Recover protocol, and I think there is a need for a protocol for vaccines as well, as Dr. Paul Marek has been saying. So fortunate for me that I am leading that as well. So I'm blessed. I'm thankful. I'm grateful for this. Okay, so with this, I'm already quite blessed and grateful that for 2 years, this service, I got the opportunity to do this service. And so it's good that it is scaling up. Now, I wanted to go over FDA's approval of Remdesivir and wanted to look at that clinical trial that they reference in their document. So don't become upset. Instead, just see how these procedures work and tell me what you think. How can what do you think the evidence is satisfactory for you or not? I'm going to present to you what FDA is presenting. And I'm not their spokesman, so don't shoot me. Instead, see the evidence. I'm just going to help us walk through that evidence. And if you're already seen, apologies. So this is drbeen.com. In the description, there is a link to about 1,000 lectures at a very reasonable price. It's a one-time fee, and it's just beautifully affordable, inexpensive fee. So take advantage of that. Now here, this is a document. We saw that a couple of days ago as well. This is April 25. Coronavirus COVID-19 update. FDA approves first COVID-19 treatment for young children. So it is 2 days ago, right? So we saw this. What I wanted to share, and let me present that their intent the way it is narrated is good. What they're saying is there are young children who are at risk. And if they are at risk, we do not have many tools for them. So we are approving it. So this statement seems fine. The only interesting thing is that the approval is not restricted to say it is for children who are, let's say, at high risk. So look at some of the things. Before now, Veklury was only approved to treat certain adults and pediatric patients 12 years of age and older who weigh at least 40 kilogram, which is about 88 pounds with COVID-19. That was before. Now, as COVID-19 can cause severe illness in children, some of whom do not currently have a vaccination option, there continues to be a need for safe and effective COVID-19 treatment option for this population, said Patrizia Cavazzoni, MD, Director of the FDA Center for Drug Evaluation and Research. Today's approval of the first COVID-19 therapeutic for this population demonstrates the agency's commitment. Okay, but now check this out. Given the similar course of COVID-19 disease in adults and pediatric patients, today's approval of Veklury in certain pediatric patients, see, they're using the word certain pediatric patients. They know that it is not needed for everyone in children. It's for certain, but in the approval, it is not for certain. Is supported by efficacy results from phase 3 clinical trials in adults. Information on the trials in adults can be found on FDA. Now, so they're saying that here we are approving it and we are taking the data from adults. Again, if we look at all of this as good faith that they're trying to provide some help, a drug that has not actually shown promising results or shown lots of side effects, picking that drug to say, let's take this to children without any trials or tests, that to me seems not the best way to do it. But anyways, they did it. Then they say, this approval is also supported by a phase 2-3 single arm, that means no placebo, open label, clinical study of 53 pediatric patients at least 28 days of age and weighing at least 3 kilograms. So this is the one that I wanted to share with you. So we read this last time too. Now let's look at the trial. So February 11, 2022. Phase 2-3 interim data evaluating the safety. So this is 2-3 interim data. And then based on this interim data, FDA said, we are moving forward. For a different cohort of the patients, it is funny for me that when all the champions of science badmouth or attack or censor those who are looking at other studies that may be small or that may have not such severe dissonance within the approval and the studies, and there is such attacks, people's careers are ruined. And here we are talking about an approval based on adult studies and this study in itself is not for the same cohort, and this study itself is not yet complete. It is an interim data. That is how it can work if you got the power. So if you've got the power, then whatever. We said we are approving it and then we're doing it. Let's now fill the page with some things to say to people that we did some thinking. Okay, so let's look at this part of the data here. In this study of 53 pediatric patients across 5 cohorts grouped by age. So there are just 53 patients and they grouped them in 5 groups. Median age 7 years and the range is 2 to 12. Remember, FDA has approved Remdesivir, I believe, from day 20 onwards, with more than half, 57%, being on high flow oxygen. So here, the empathy that we need to have is that these are children who are sick, and they are so sick that they are hospitalized. So for such children, there needs to be tools. I totally agree with that. So they are on high flow oxygen, mechanical ventilation, or extracorporeal membrane oxygenation, where the blood is brought out and then processed and brought back, ECMO. So that was the starting point for these children. They were already in the hospital, half of them on high flow oxygen and so on. Of the 53 pediatric patients enrolled in the study, no new safety signal were apparent for Veklury. Overall, 38 patients, 72%, experienced adverse effects, with 11 patients, that is 21%, experiencing serious adverse effects that were determined not to be study drug related, including. So, does this statement mean all of the adverse effects were not, or just the serious one were not? That's not clear. So, I would suspect they're saying all of them, including 3 participant deaths, which were consistent with the patient's underlying medical condition prior to study entry or with COVID-19 disease during hospitalization. So they're saying it was not the drug. Children weighing at least 40 kilograms were in cohorts 1 and 8 and received 200 milligram on day 1, followed by 100 milligram daily. Infants and children weighing 3 kilogram to less than 40 kilogram were in cohort 2 to 4 and received weight-based dosing of 5 milligram per kilogram on day 1, followed by 2.5 milligram per kilogram daily. In the analysis, the most common adverse event in patient taking Veklury was constipation, 17%, followed by acute kidney injury, 11%, hyperglycemia, increased glucose, 9%, and pyrexia, fever, 9%. Additionally, 8% of participants had an increase in alanine transaminase, ALT, the liver enzyme. So this is the data. Interim results, small study that FDA used as one of the studies. The remaining studies are adult studies, and they use that and they said, you know what, this will work here as well. Remember, FDA was going to do the same with the vaccine for the younger children as well, where the vaccine company stepped back and said, no, we're not going to do it. So anyways, this is how FDA rolls. What do you think? Does this seem like good evidence for you to say, let's say if you were FDA, would you look at this and say, okay, you know what, makes sense, let's move forward? While we're talking about Remdesivir. Okay, so this is this. How is everyone doing? Dead Tudor says, I don't like it at all. Jim is here. Hey, Jim, how are you? So this is a good question. Does ivermectin work? I have no idea. Can these kids afford after adverse events? Now, I do not know you're talking about ivermectin's adverse effects or Veklury's or that little study that I showed. Give me some more. So Robin says, I see that WHO updated its statement on remdesivir. Let's see. What's that statement? WHO Remdesivir. I'm gonna share my screen. I know I need to share my screen. Should always keep the screen shared. This was actually unsharing is courtesy of Doug. He, excuse me, he had once said that can you stop sharing when you're talking, something to that effect. Okay, so WHO Remdesivir after, so you said 422, so let's say 022 0301, 6 days ago. WHO recommends highly successful COVID-19 therapy and calls for wide geographical distribution and transparency from originator. Today, so this is the one that you're talking about. Today, WHO made a strong recommendation for nirmatrelvir and ritonavir. So that is Paxlovid, sold under name Paxlovid. Okay, yeah. For mild and moderate COVID-19 patients at high risk for hospital admission, calling it the best therapeutic choice for high risk patients to date. Okay, that's not bad. Okay, what else? Pfizer's oral antiviral drug. Okay, this recommendation is based on new data from 2 randomized controlled trials. WHO one. WHO is extremely concerned that, as occurred with COVID-19 vaccines, low and middle income countries will again be pushed to the end of queue when it comes to accessing the treatment. Remdesivir here. Along with a strong recommendation for the use of nirmatrelvir and ritonavir or Paxlovid, WHO also updated its recommendation on remdesivir, another antiviral medicine. Previously, WHO had suggested against its use in all COVID-19 patients, regardless of disease severity, due to the totality of the evidence at the time showing little or no effect on mortality. Following publication of new data from a clinical trial looking at the outcome of admission to hospital, WHO has updated its recommendation. WHO now suggests the use of remdesivir in mild or moderate COVID-19 patients who are at high risk of hospitalization. The recommendation for use of remdesivir in patients with severe critical COVID is currently under review. So, a quick note for why this can work earlier but not late. It is an antiviral. Antivirals should work in viral phase. Somebody who is in the hospital, somebody who is in the on the ventilator, they are beyond the viral phase, and that is where remdesivir is really not in all cases useful. It may be that there are some patients who have such comorbidities that the virus is not cleared out correctly or completely, and they would benefit from antivirals. So here, this is interesting that they said mild to moderate and something to reduce ending up in the hospital. So that means more of a outpatient type situation, not really outpatient, but more of a viral stage. So thank you, Robin, for bringing it up. It's an interesting update. I need to look at that study that they are referencing and discuss it. Where is that study? It is just so bad that some folks, some organizations don't link those things. I do a better job than then. I have every single paper or article that I use linked in the descriptions. Anyways, correct. So antivirals of whatever type, good or bad, if they have to be given, they should be given during the viral phase. So Texas is saying that please tell Barbara to keep spirits up, nourish body, heart, and soul. I hope Barbara is okay. How is Barbara okay? And Lotus okay? Oh, got it. So Barbara is saying that I had EBV reactivation last time for forever too. What a I hope that you recover soon, Barbara, and I hope you're doing okay, and I hope Lotus is okay. So not that report, the top link. Go to the original post where they, yes. So I know that originally they did not report approve it. Looks like now they've changed it. Good if they have a study that they feel shows enough data. I would love to see that too. And Bromley says, how can they do something like this with a straight face? They must really think we are all asleep. I don't think that they even care that if we are awake, they'll be they'll be kind of nervous about it. I don't think they care. So I don't think they care that we are asleep or not. I think they actually know we are awake, but they just don't care. And I have always seen my whole life when somebody is trying to pull off something strange, they would put it under two slots: national security or your safety. They will plug that message in that slot, and all of a sudden, that message will become all kosher and can be then used. So, here, as you saw, and this, I'm a strong believer that there are in every age group, there are going to be patients who need help because their immune system may not be able to help them, or they may have comorbidities that put them at greater risk, and they need to have every stone um, turned for them. But the wisdom has to be to say, here are the groups for whom this is done. And that wisdom, I think, maybe they think that it would cause confusion, but I don't think so. We're talking about hospitals where protocols are there for every other thing. It just takes some more work to create the protocol, to say, here is the decision tree. And it seems like if you don't want to do that tree, you'll just say everyone. M. Gregory says, who cares then? M. Gregory, for us, nobody would care except ourselves. I think that is the most important lesson for our lives. I used to, in the younger age, I used to, for example, think that, for example, my country, previous country, people should not take bribes. They should not lie. They should not be able to hit each other. You know that in Pakistan or even in India, sometimes you can just hit others and you can get away with that, and there is no repercussion. It's just whoever is stronger. And it turned out that just wishing would not work. And that would also not prevent people from being that way to, let's say, me or others. And even now, this is the first time in my life in the US that I saw a similar behavior, although a different set of methods, where people are trying to silence each other by complaining or by doing what you see, the harassment. And at the end of the day, um, I was near 40 when it dawned on me. So, quite late. There are youngsters, intelligent, wise, brilliant, who are more street smart. I'm not street smart, who know this at an early age that there is no one who's going to come to help. It is you, yourself, and you are responsible for your help. And there is no need for complaint. So when I learned that, since then, it has been a very different life for me. I do not worry about things going one way or the other, because at the end of the day, it is me who has to take care of me. And so once that responsibility falls with me, even if it is somebody else's creation, for example, these complaints, These are by some folks, some of them I know, some of them I don't know. But the fixing of the problem is still my responsibility. So I think that's the situation. Nobody's going to come in. It's us, we. It is wiser if similar minded folks get together and help each other. That is what I'm seeing is yet happening in small pockets. For example, there are groups for long COVIDs or vaccine related problems, but it still is a divided and fragmented area. So, for example, FLCCC or other such organizations, I respect them for this, that they have put together um, teams and they have pulled people together to come get educated and get their message. KB Usenet says, very well said, a lesson we are trying to teach our teenage daughters. Absolutely. And look, I learned it near 40. So it will be great if she would get this message now. Yes, the power of the group is very important. The power of a tribe is very important. Um, there was a wise man around me when I was growing up. He used to say that even animals live in packs. And he said that gives them protection, that gives them strength, that gives them companionship. And so humans have a higher need to be in tribes, in groups, similar minded. What I've seen is this is impossible that all humanity can be one group because everyone has a different mindset. And so, because of that, there are different nations and there are different groups. But still, being coming together to for a mission, I think is the best calling and best part of her life. Elizabeth says, a friend just got COVID, Omicron timeframe, for the second time. Possible that this time it's IIB. IIB, sorry, I missed it. Elizabeth, can you please tell me? Doug, how are you? We were thinking of you today about me sharing the screen or not. Hey, Paul Bork, how are you? 50% likes. Let's push the likes up. Anne Bromley says that would be a great illustration, the decision tree. And Anne, without asking you, if I can actually share with the KoolBeens here, um, team for the Substack writings, Anne and another journalist, very very good writers and documentary video creators, Linda and Anne, they are helping me, and they're excellent. And you've seen it is so funny on Substack. Sometimes I write and publish it, and sometimes Anne would help me from a video to write the notes and article and then help me publish it. And whenever it is Anne's writing, people would say very well written. And I kind of smile because it's not my writing, it is Anne who writes it. She's the team member. I hope that we can continue to support this activity, but she's the one who's helping us with Linda to start creating this book and start creating these notes. So let's see how far we can take it. I am pretty confident that it is a very good activity to bring things in writing. A lot of KoolBeens had been saying that, hey, can you give us cliff notes? Can you give us something in writing that we can read? And if we don't want to watch. So I think that parallel effort is very decent. So, and I disclosed you without asking you. So apologies if you didn't like it. I'm sure that you're okay with it. Oh, Lisbeth says BA2 or Omi Omi. So latest ones are BA2s. Um, Omi Omi maybe, but most of these are BA2 subvariants. M. Gregory says, I'm not going to that cafe again. Which one? I hope it's not Cool Bean Cafe, some other cafe. Cool Bean Cafe is cool. This is horrible. I spent dollar at a coffee and that today they won't let you use the bathroom unless vaccinated. What is going on with? Yes. Meanwhile, in America says, quoted myself in second person like Alquin. Yes, Alquin is making us all do that now. So, Ashley, I'm sure you've been asked this question. Not only asked this question, I have answered it many times, and then I've gotten the heat for answering it the way I answer it, and I'm going to answer the same way. No, vaccines have no role in creating variants. The worst time was once when I did this, there was a gang of people who used to be on our channel as well, and they'll comment and very good discussions. But at one point, when this kind of a message I made, they became totally upset. And then it was just a war for a few days that one person will come in and attack me, and then I would block them. And then another person would come in and say, why did you block them? And then it was just horrible. But I still am of the same opinion that from a mechanism point of view, vaccines are not causing variants. Virus itself is causing variants, and our bodies are helping it make variants. And there are so many factors, people who are immunosuppressed, people who may be uncontrolled diabetes, the virus itself would make variant regardless. And then that's just how it is. So, Les, this is a very good point. That does the effect on fetuses suggest to you that the med should be or to be prescription rather than over the counter? And maybe they would come out and they'll say not over the counter because somebody can accidentally take it and they may be pregnant and they may not know it at that time. And then later on, it becomes a problem. So, I would prefer this to be prescription as well, just for this one important part. It's not a trivial thing that somebody may be pregnant and took a drug that may be teratogenic or harmful for the child. Yeah, WTF. You're correct, Denise. What is going on? Yes, I have. Have you seen other patients with increased motion sickness, nausea after COVID? Yes. Because of the ear involvement and neurological involvement, this has become, and GIT involvement, this has become very common. Gene says, regarding 3CL protease inhibitors, like we talked about that today, and the Paxlovid, are you familiar with Todo's meds Tolovid and over-the-counter 3TCL protease inhibitor? Really? No, I'm not. Tolovid, a drug produced in clinical trials based on an extract from Gromwell root. No, that is so interesting. Let's see if we can look at it. Gene comes with a brilliant message. So Tolovid, I want to see the mechanism. So there are Todo's medical or Todos. distribution rights to delivery of supplement Tolovate. Tolovate is a powerful proprietary blend of plant extracts that help support healthy immune system. Scientifically studied, traceability, vegan. Okay, so this is not a sponsored thing, and this is also not a endorsement of the product. I have no idea. I've not seen the mechanism. And of course, if there is a drug that is powerful enough and doesn't have side effects, as we saw, only then it might be, meaning it has to be harmless. Otherwise, it cannot be over the counter, especially teratogenicity, meaning 3CL pros inhibition can cause um, fetal formation issues. And so if this drug does it, if it is that strong, then this would do that too. So Gene, thank you for sharing it. I'll have to do some research on this to see how does it work and what are the side effects. Here it says, did I understand that the new Japanese antiviral med is effective against the most common symptoms of Omicron? I wonder what the rest of the 12 symptoms were. So yes, and I'm actually searching too. The whole day I was searching phase 2 trial. I think it must be somewhere in Japanese, and I did not find it. And I was trying to go to the Shionogi's reports as well to see, maybe because they keep bringing up their trial. So I thought maybe they would have a link somewhere, but there is no link. Meat in my teeth says, if a long hauler is allergic or reacts negatively to ivermectin, what other options do they have to clean up viral debris? Check the iRecover. There are many options, and I hope that you'll feel good that Dr. Paul Merrick and I am discussing it every day for alternative possibilities. What other medicines could there be? So we'll come up with some more data and more information and more updates, but check the iRecover. So I already see in the comments, T. Oliver has started his messaging that there are edits. So look, I have always maintained this. The edits, I have no idea when were they done, who did them, they were natural or not. That is the beginning of the virus. How did that happen is still a mystery for, I think, for the whole world at this time. There are so many conjectures, hypotheses. I have not seen it, number one. Number two, I do not have that leaning to go and do that research. We all have taken various kind of roles. My role has been, how do we get through this problem now, whichever way it got started. However, as the pandemic would wind down, and as we look back and say, man, this was a terrible time, there are going to be people who are going to say, we need to understand, where did this thing come from? We need to understand, where are those abnormalities, genetic fingerprints on it that are interesting to see. The variations afterwards, if, for example, you suggested that there is someone sitting in a lab and continuously creating variations and sending them out, then that would be wrong. Similarly, if somebody said that vaccines are causing the production of variations, then that would be wrong as well. So beginning, I have no idea. And it may be because how did a coronavirus just end up being such a more disastrous than a nuclear bomb for the whole world? That needs to be seen. natural or not, that needs to be investigated. So that's fine. But the variations that are happening, deltas and omicrons, I don't think that are coming from somebody sitting in some lab just saying, all right, I'm going to give a new variant. That's not happening. Meeple says, to increase viewers here at the end of the main talk, you may want to call channel its full name, KoolBeens Cafe Live, rather than Chit Chat channel to assist. That is a very good idea. Plus, I think I should start adding the link to this channel in the description of the other one and maybe paste that link at the end as well. So I would try to change my habit from tomorrow. Carlos says, if someone was exposed to COVID via ingestion rather than breathing it in, would you expect a more or less severe disease, assuming inoculum is the same? I imagine less severe. Many times we would not even know. And it's only 4% of the people who can get gastroenteritis. Many times we will not know, the virus would go, some of this will be destroyed in the stomach, although it has a bunch of spike proteins on it, which allows it to kind of escape the stomach enzymes. But some of it would be destroyed there. Some of it will be just passed out. So it would have a hard time to just very quickly infect, but it can cause gastroenteritis. And sometimes COVID can start from gastroenteritis instead of the upper respiratory tract infections. So your word, meanwhile in America, often can help you with your sentence because it is possible that some of it is killed off. But coronaviruses can actually escape the stomach acids because of their structure, and they can cause gastroenteritis. But you're correct that in majority of us, these would become eliminated in they won't have that good of a hold in us as they do with the respiratory system. So have you had anecdotal through FLCC that Nigel and honey? I haven't, but this is something that we are very, very much used to seeing it work. And so I believe it works. That study was good. There are many other studies on this as well. Correct. So, correct. So there is going to be a different set of people. That's not going to be us, or at least not me and the group here. We are not investigators of this type. We don't even have resources. We do not even have the access. So for me, I would rather use that time where I'm going to discuss this. I would use that time to something more productive where I can add value. But there are going to be investigations. There is going to be people who are going to doggedly continue to figure out where did it come from. And maybe the answer at the end of the day would be it was genuinely originated from animals. And sure, but I believe that would happen, that as we come out of COVID, we get our orientation again. There are going to be researches in the future. Doug says good night. Good night, Doug. Texas Max says good night, famous. So meanwhile in America says, do you think it's true likely that you can get COVID infection via membrane like eyes? Yes. So COVID likes to adhere to the mucous membrane and cells there. Because it's a respiratory virus, it finds it easy to be in the fluid mediums because it has a membrane around that. Membranous viruses cannot survive very well on the dry surfaces. Imagine we need to keep our skin, wet or moisturized. Imagine a tiny microscopic thing which has just stolen a very tiny part of our cell membrane. That's such a delicate thing that if it doesn't have the correct moisture, it's going to be dead in a second, or as we call it, inviable or not viable. So wet surfaces are good for it, and then it can connect to the cells. So any wet surface, not only mouth, nose, and eyes, any wet surface that allows it to be there. Now, you might think, for example, vagina. In vagina, the environment is such that many pathogens cannot easily stay there because the acidity is present. In the GIT, there is stomach that acts as a barrier, but coronaviruses in most cases can become invalidated there, but some of them would even cause infection. So similarly, for genitourinary, that tract is very difficult for coronaviruses to hold on to, because as soon as we pee, we kind of push things outwards. And that is a smaller and more difficult tract to enter. But wet surfaces would allow the virus to stay viable while it tries to hook onto the cells. So we will draw tomorrow. KB Usenet. We'll draw tomorrow. Tell me, one, I was trying to say maybe I should learn to draw a cat and we draw that. Otherwise, we'll continue with our drawings. Ashley says, remember COVID arm, and everyone was talking about it constantly at the beginning of the shots. That stopped totally, at least discussion about it. Did they determine why it was exactly? So, no. I need some more info. Meanwhile, goggles and glasses, yes. Paul Borg says drawing will be good. Awesome. So we'll draw tomorrow. Quinn made a cat. Okay, cat it is. Vinod says, how do doctors test remdesivir compatibility, safety for a particular patient, or they don't? They don't. The basic idea is to first do it in the cells in vitro, then do it in test it in animals, then bring it to some volunteers, and then for every cohort there has to be a trial where you try it on some. I need to start wearing my glasses everywhere. Where is Elquin? I'm not seeing Elquin's turtle. I just saw the goat. Excellent. So, how about we break today? Where is Luffy, roller girl? So, Luffy woke up about 5 o'clock, and then I opened the door for him. He went out. Then I was trying, so my wife was not home today. So, I was trying that he comes back before I start this talk. But he came back. I closed the door. He started whining. So I opened the door again. And then my wife came back as well. And so I think she can take care of him coming back. So how about we break today a little early? And that would give me a chance as well to go have dinner with my family as well today. last 2-3 days of fastings. So my customary messages: like, subscribe, and share. And if you can, there are links in the description. If you would like to support this work, you can buy me a coffee or become a patron, or PayPal or Substack. All links are there. Or you can buy DrBeen.com access, which is for a very, very affordable price, the access to all the 1,000 videos one time. So consider that, and thank you very much. I'll see you tomorrow.